Hello everyone, I'm Lisa Quigley, the Mind Matters Initiative Manager. In this talk, I'm going to give a bit of background to today's event, including an overview of the themes coming from our student veterinary nursing survey. And there's four main themes I'm going to talk about today. And as you'll have noticed, these formed the basis of the topics we're all discussing today. So first, just a bit of background to this event and to the survey. So back in 2019, we held a veterinary student roundtable in London, and we had staff representatives from all the vet schools, along with a student rep from each school as well. And the data took a really solutions-focused approach to look at ways vet schools in the UK were already addressing issues impacting on vet student mental health and wellbeing, and also what more could be done to support them. And the plan was always going to be to replicate this event for student nurses. And this obviously got a bit delayed during the pandemic. But whilst we were planning our student nurse event, which later became this event that we're at today, it kind of became apparent that we didn't actually have a clear grasp on what the main issues were for student nurses and newly qualified nurses. So whereas for the student vets, there was a pretty solid body of research and knowledge there. And we had a really good handle on what they were finding difficult, where they needed support, and that knowledge was really lacking for the student nurses. We just didn't know. And so it didn't feel right really to launch straight into an event that was going to be attended primarily by senior figures looking at addressing issues around mental health and well-being, when we hadn't yet done the groundwork to listen to the nurses and the students themselves and find out from them what the issues were that mattered most to them, where they needed support and what they wanted that support to look like. And so that's what we set out to do with our survey and with this event also. So we conducted a survey, and we're really grateful to all the organisations and student nurses and RVNs who helped us to develop this. And this ran over the summer. We asked student and newly qualified nurses questions about issues impacting on their mental health and well-being, their views on nursing as a profession, and also the kind of support that they needed. So from us, from educational establishments, and from the profession as a whole. We also asked clinical coaches to complete the survey, and we asked them about their experiences of supporting students. We had over 650 responses, which was fantastic. And each of the questions had an optional free text response. And I really did wonder if this might result in a bit of survey fatigue and a lack of that qualitative data we needed. But I really didn't need to worry about that. So we've just been blown away by the time, the effort and the detail that people have put into their responses. And it's left us with a huge amount of data. And I am still wading through that. But very early on, there are four very key themes of areas where people are finding things difficult and things do need to change. And that came through incredibly strongly, and to such an extent that we just can't just ignore it or not talk about it. So those themes have formed the basis of today's event, and I'm going to talk about them a bit more now. So the first theme is bullying and incivility. And if you've seen the press around this survey, you will have seen that they led with this, because some of the findings are quite, I don't want to say shocking, because I don't think some of you here today will be shocked, but they were really quite saddening. And we found that 96% of those that we surveyed believed or strongly believed that bullying and incivility was a serious problem within the veterinary professions. And what I didn't add there is that of the remaining 4%, 3% were unsure, 1% disagreed. And we can't shy away from this, so that is unacceptably high. And I wanted to talk a bit about some of the context to that high figure, which came through in the free text responses. So one thing that came across in the stories people were sharing is that sometimes, and by no means always, so this bullying and incivility was connected to what are known as protected characteristics under the Equality Act, so sex, disability, pregnancy, and it was quite interesting that a lot of people describe this kind of bullying in response to the bullying question and not in response to the discrimination questions we asked. So this does raise a question in my mind as to whether people are fully aware of the protections afforded to them under the Equality Act if they do have a protected characteristic. Because obviously bullying, when it's linked to a protected characteristic, it then becomes what we call harassment. And I do think there's some scope for further education for the professions on some of these terms relating to employment law and their rights under the Equality Act. I'm going to talk a bit about microaggressions later, but certainly some of the stories people shared would come under this category. And bullying, it wasn't always connected to a protected characteristic, but a common feature here, and as in all bullying really, was a power imbalance. So those more senior, and whether that's in terms of position, length of service, and sometimes behaving poorly towards those with lower status, less protection, less security. So one thing I wanted to be really clear on here, and it's something I've been challenged on quite a bit since these results came out, this is not a case of students and newly qualified nurses being snowflakes, lacking resilience, or any of that rubbish. So when you come out with concerns about bullying and incivility, often people will say, oh, we can't have any robust conversations anymore, or we'll be accused of bullying. People just can't take constructive feedback. And now I've read every single response to the questions that we asked about bullying. So I can tell you, people were extremely clear on the difference between someone having an off day, being a bit snappy, giving a bit of criticism, and bullying. So of the examples given, and this is just purely my assessment, maybe a handful might be, if we're generous, considered to be a difference of opinion or a personality clash. But that really wasn't the general sense, and I really wanted to get that across. So the severity and seriousness of the poor behaviour, it did vary from kind of low level, but still unacceptable, incivility and rudeness, and it went all the way up to kind of sustained behaviour that was really quite crossing the line into being unlawful, actually. And I just really wanted to be clear on that, because some of the stories people shared were absolutely unacceptable, and I think I'd be doing a real disservice actually by playing it down and saying it's not really a big problem, or it's all a matter of interpretation and we just need to build resilience. And that's absolutely not what the data showed at all. The other question I get asked is who is doing this bullying and incivility, and we didn't actually ask that question, so I can only give you my assessment of the qualitative responses. And in response to this particular question of the survey, which asked about incivility and bullying, the majority were talking about treatment from nursing peers, fellow students, educational staff, vets, head nurses. So we weren't seeing so much here in this particular question about incivility from clients. What we did see, though, was in response to our separate question about workplace stresses and interactions with clients and respect for the nursing profession. That's where those tricky interactions with clients came up. And then finally, so we didn't really delve into the reasons for such high levels of bullying in the profession, but there is a general sense and responses, and it seems reasonable, that things have been exacerbated by COVID-19 and by those additional workplace stresses. And that's not to excuse these poor behaviours by any means, but it maybe goes some way to understanding what's been happening. And I do think we need to be mindful amidst all this that anyone behaving in these kinds of ways is likely to not be very okay themselves. So moving on to theme 2, we have juggling demands. First, we have the findings that 81% felt vet nursing was stressful, 78% were finding that the demands of work or study were negatively impacting on their well-being. So we know this is really tough, especially for student nurses who are juggling work and studying, as well as family caring obligations, and also somehow trying to fit in some self-care. And you can see from the quote on the right there, and we saw this in quite a few responses, that self-care was often the first thing to fall by the wayside when things got tough. And this also has implications for us and work we do in MMI. So it's one thing, we talk a lot about self-care and wellness. So things like going for a walk, taking an exercise class, or learning a new craft. But what we're seeing from the responses here is people feeling they're literally at breaking points. So not having time to go to the loo or to eat. And then at the next level, dental and medical appointments just completely out the window. So we need to be careful that we're not promoting these self-care and well-being ideals in a context where people are struggling with the very basics. Unsurprisingly, COVID has tipped the situation from just about manageable to really being quite unsustainable. However, the majority of student nurses, they did feel well supported, 51%. I'd argue that should be a lot higher though. But there are clear indicators on the whole, clinical coaches in particular, providing really excellent support. And again, in terms of the quality of the training, the vast majority felt that it was equipping them with the skills and knowledge to be a really good veterinary nurse. Theme 3, so this was disability and chronic illness. Around a third of our respondents identified as being disabled or as having a chronic illness, and approximately 1 in 5 identified as being neurodiverse. So responses relating to this topic, they back up a recent survey carried out by BVNA and the British Veterinary Chronic Illness Society, who you're going to hear from later. So some really disappointing stories of harassment, discrimination, failure to make reasonable adjustments, both in workplace and educational settings. And I just want to really applaud the microaggression campaign that you may have seen being headed up by BVA and others, including the BCVIS. And this is really timely because we did see many examples of microaggressions similar to those on the poster be coming through from our research. So I just wanted really to add our voice in support of this campaign, because these types of comments, whether intentional or unintentional, and they often are unintentional, they really do hurt people and do a lot of harm to individuals and to teams. There was a common theme also of this feeling of letting people down, of feeling or being made to feel like a burden, particularly in the context of COVID. So needing to take time off, shielding when people are so busy and demands are so high. And this has been really difficult for people. We looked at what helps also, and it came through very clearly that for people living with chronic illness or a disability, having supportive colleagues makes all the difference between thriving in work and just barely surviving. So that's a really protective factor. And we saw some really strong examples, which was lovely to see, of teams, colleagues, fellow students, really looking after each other and supporting each other, which is really great to see when things are so tough for everyone. And now onto the final theme we're looking at today. So awareness, recognition and pride. So first, let's look at the good side of things. So the majority, 70% of nurses and newly qualified nurses, they felt confident they'd chosen the right career path. What also came through really clearly was this enormous sense of pride in their chosen profession. So their skill, their competence, their ability to care for patients, and really importantly, their ability to look after each other when things get tough. And on the less positive side, and this reflects what I often hear anecdotally, there remains this overwhelming feeling that vet nursing just isn't respected. And it's a flaw of the study design, I think, that I didn't actually ask, but by who? And in the responses, it seems, from what I can see, to be a mix, sadly, of not being respected by the public and also not being sometimes respected by vets. Low pay was cited really frequently as being an issue, not just in terms of not being able to afford the quality of life that they needed or wanted, but because of what that means as a reflection of how much they're appreciated, valued, and respected, and this feeling that the low pay is a sign that those things are lacking. Many people commenting on the way student nurses are essentially unpaid labour, and this feeling that that needs to change. There were a few comments relating to the role gender plays or might play in this. So we know veterinary nursing is a predominantly female profession, and some of the responses raised questions about whether it would be better paid if it wasn't the case. And if it was more men in the profession. One thing I saw also was this feeling that the public don't fully understand the role of a veterinary nurse, the level of training and expertise. And then finally, that sadly there are some other roles in practice sometimes that don't get the recognition and respect they deserve. So people mentioned receptionists, animal care assistants, or as somebody puts it, just anyone who's not a vet. So that's an overview of the 4 key themes that were raised as negatively impacting on mental health and well-being. And you'll see that the topics we are talking about today are informed by those themes. So what next? So the outcomes and discussions from today will directly influence our strategy for 2022 to 2027, where veterinary nursing will be a key area of strategic focus for us. We recently announced a championing equality collaboration. This is with the British Veterinary Chronic Illness Society, with VetLife, the British Veterinary Equality and Diversity Society, and the British Veterinary LGBTQ+, which will start to address some of the issues we've identified, and others have also identified around discrimination, and particularly in the context of disability, but across the board. On the week commencing 15th of November, we'll be announcing a collaboration with BVNA. This is being released in time for Bullying Awareness Week. And this will outline our approach to tackling the concerns that have been raised about bullying and incivility in the profession. So do keep an eye out for that. And also just a commitment from MMI that through events like this, continuing to engage with and listen to the nursing community and carry on, our commitment to carry on asking questions, even when the answers are difficult. And some of the answers to our survey really were quite difficult to hear. But that doesn't mean we shouldn't keep asking the questions and talking and being open about what's happening. So today there's going to be a number of breakout rooms, and I really hope you'll take the opportunity to share with us and with each other what are the pain points, so what things hurt right now, what will help, what do you need from us? So from us personally, from MMI, there will be some things that we're able to do, also others that sadly are outside MMI's sphere of control. So think also more widely. So what do you need from colleagues, from the wider profession? And I really hope you'll find some of the discussions useful and an opportunity to share your experiences and to help us to start make things a bit better. Thank you very much.